Radio Now 100.9's Indy Connection with Emily Metheny.
Hello, I'm Emily Metheny, your host. This week, I had the opportunity to speak with Dr. William Gill, a member of the American Heart Association's local board and a cardiologist at IU Health. Dr. Gill joined the show to talk about taking care of your heart in American Heart Month, which starts on February 1st. We also talked about how COVID impacts the heart, but first, we talk about how February became a month focused on heart health.
So, heart disease is the number one killer in the United States and frankly worldwide. And I think that it deserves our attention. And so there's a Heart Month, coordinated, of course, with what we sort of traditionally consider our heart holiday, which is February the 14th. And so for the month of February, we celebrate heart disease in the United States. And insofar as we celebrate it, we celebrate the things that we can do to prevent heart disease. We remember our loved ones who have been touched by this, which most all of us have loved ones, friends, family, etc., who have been affected by heart disease in some way, shape, or form. And when we in the American Heart Association think about heart disease, we're of course thinking about cardiovascular disease, heart attack, congestive heart failure, valvular heart disease, but we're also thinking about stroke and brain health as well during this time.
Mm-hmm. And here in Indiana, it's approximately 14,000 deaths per year, and that's enough to fill Victory Field, which is still causing this to be a number one cause of death despite the COVID pandemic, right?
That is exactly correct. Yes, yeah. So heart disease still remains, unfortunately, the number one killer in the state of Indiana. It's the number one killer nationally, and so we are clearly all suffering the effects of the pandemic, and we're having to do what we can as individuals to sort of stem the tide of COVID in the United States and worldwide. But to neglect heart disease at any point in time would be a tremendous oversight. It's interesting that we learned a little bit of a lesson from the original response to the global pandemic back in March of 2020, where in the United States we were short on PPE for healthcare workers and first responders, and so we had to shut down most all of our surgical services, procedures, et cetera. And what we learned from that event was that when we shut down cardiovascular services, delaying open heart surgery, for example, delaying heart catheterizations and other diagnostics that we would normally have been doing on a routine daily basis, what we came to learn was that these patients just ended up presenting sicker to our hospitals, taking up precious resources and suffering the consequences of delayed care. So today, for instance, as we are actually once again necessarily having to cut back on outpatient and elective surgical and other procedures at many of our hospitals around the state of Indiana, one of the things that we're not doing this time is waiting on taking care of our cardiovascular patients. And so they're getting the timely care that they require so as to limit the consequences of their disease.
So continuing kind of on the topic of COVID and the heart, there's been some information that's been found out that there's a link between COVID and heart and impacts on the heart.
Correct. So, the original link was frankly made from the very first afflicted by COVID-19, and that were the folks in China. And it was observed by the Chinese physicians that there was a measurable, what they perceived to be high rate of incident cardiovascular events in patients who suffered COVID. And one of the things that they learned from some of their autopsy series and things like this very early on in the first couple of months of the disease was that myocarditis, which is an inflammation of the heart, was something that they observed early on. They also observed that there was a heightened risk for clotting disorders. So individuals that had blood clots throughout their body and their legs and their lungs, and possibly increased risks for stroke as well were observed. This myocarditis risk is something that we continue to sort of study and learn about today. Suffice it to say that there were some early studies in the United States that looked at cardiac MRIs, specifically of athletes and young people who had COVID, and there seemed to be a rather high measurable rate of abnormalities found on cardiac MRIs. It turns out that as we've continued to study the disease state, it seems as though this risk for myocarditis is quite a bit less than initially was thought, but it is still something that is present and something that we are aware of, such that for young people and athletes in particular, we have return to sport guidelines now that recommend, for instance, that we get blood tests, specifically a blood test for this protein called troponin, which is typically found just in the heart, but when we find it in the bloodstream, it's because something was going on with the heart. So we check a troponin level and we check an EKG on most of our athletes prior to them returning to sport. And we think that that's an important thing for those that have been afflicted with COVID because of the risk of myocarditis, which may be asymptomatic initially until it progresses and can cause more severe forms of cardiovascular disease, including congestive heart failure, rarely, very rarely, fortunately, death or need for heart transplantation.
And has this been continuing to be seen in people who have been suffering, like as a COVID long hauler?
Yeah, so for the COVID long haul syndrome, the first thing I guess I would say about it is it very much is an entity that afflicts, fortunately, only a small percentage of individuals, but it is definitely a major challenge for those people. To the best of our ability to tell, myocarditis and cardiac disease is not a prominent component of COVID long haul syndrome. And so no doubt we continue to study COVID long haulers to try to better understand what is going on in these individuals, such that we hope someday to be able to help them to get over this in a much more timely fashion, return to their lives and feel more normal again for themselves. But to our ability to tell, while we always exclude or attempt to exclude heart disease as a contributor in these cases, the good news, to the best of our ability to tell right now, is that cardiac complications are not at the fore of COVID long haul. The one other thing I guess that I would say in relation to COVID long haul syndrome, there are some cardiac associated findings with COVID long haul. For example, there tend to be in many individuals a higher heart rate and symptoms that are akin to what's called POTS, P-O-T-S, which stands for postural orthostatic tachycardia syndrome. And so while we in cardiovascular medicine tend to patients with POTS, POTS itself is not a strictly cardiac disease per se. It involves changes with the autonomic nervous system and blood pressure and blood vessel changes with regard to positional change, standing up, for example, for prolonged periods of time, or even maybe sometimes just first standing up and things like this. So some of the COVID long haul individuals, in addition to having a lot of symptoms of fatigue, exercise intolerance, and shortness of breath that kind of persists for prolonged periods of time, many of them also have objective findings of higher heart rates, orthostatic intolerance, such that they get lightheaded, feel weak and queasy when they're up on their feet as opposed to when they're sitting or lying down, for example. But as a specific cardiac issue, like myocarditis is a specific cardiac issue, we don't tend to see that so commonly in the COVID long haul syndrome.
And with COVID, is there anything that impacts your blood pressure after you've had COVID or while having COVID?
COVID itself has variable effects on blood pressure, frankly. We have many of our patients who are profoundly hypotensive when they are most ill with COVID, and we believe this to be principally related to the fact that their body is just fighting like crazy to try to wipe out this viral infection, and we develop a syndrome that we call sepsis syndrome, where heart rates are elevated, blood pressures are lower. Patients oftentimes require multiple intravenous medications to maintain a livable blood pressure, to continue to perfuse or send blood flow to vital organs like the brain and the kidneys and the heart itself, and so on and so forth. But we don't find that this is unique to COVID. This is a response that we see in many, if not most, serious or overwhelming infections of the body. So other forms of pneumonia, other forms of severe infections, such as a really bad life-threatening kidney disease, et cetera, or kidney infection, all of these might cause a similar drop in blood pressure, for instance, with COVID, as COVID does.
And you mentioned a little bit earlier, Dr. Gill, that a lot of people have been putting off routine medical care, especially preventative care.
Yes.
What can people do to be able to start coming in if there's a concern about returning to the doctor's office?
Right. So the first thing that I tell my patients, frankly, is that I want them to have confidence that that they can come and see me, that it's safe to come to the doctor's office, and that, as I tell them, I said, I feel very confident being at work. I think that IU Health, where I work, but I think all of the hospital systems have really taken it upon themselves to protect the caretakers, the physicians, the nurses, the technicians, and everyone at work. And because they're doing such a great job of protecting me, they're doing a great job of protecting my patients. And I'm reassured by that. And I want to reassure my patients of that. Perhaps unlike any other place, short of their own home, assuming they let nobody in their own home, unlike any other place, our hospitals mandate masking, excellent hand hygiene, and they're doing a nice job of providing space for social distancing. And so sort of public health 101 measures where we are, trying to isolate, protect ourselves, and the masks actually matter. They really, really matter. These are the kind of things that are protecting me, and they will protect my patients when they come in to see me as well. So I want my patients to feel confident, as I feel confident, that they'll be safe coming into the hospital. And I don't want them to delay care for urgent or emergent needs. And so one of the other things that we saw that was very interesting with the original shutdown and the emerging pandemic back in 2020 was that there was a marked drop in the number of patients that presented with acute heart attacks and strokes. And this was seen initially and reported initially in Italy. And of course, Italy was about 4 to 6 weeks ahead of the United States in their COVID experience. And then we experienced almost the exact same thing here in Indianapolis and throughout the United States. I'll give an example. In 2019, in April and May of 2019, we had some 40 or 45 individuals that presented with acute heart attack to our hospital at IU Health West. In 2020, in April and May, instead of, I think, the 45 that we had 19 that presented with acute heart attack. And unfortunately, what we believe was going on was that people were feeling very concerned about coming to the hospital, recognizing that there were COVID patients at the hospital, and felt that, boy, if I go to the hospital, I'm just going to get COVID. And subsequently, they decided to take their chances and stay home, even when they were having heart attacks, perhaps. And so this resulted, we're certain, in an increased risk for sudden death at home and increased risk for consequences of untreated heart attacks like congestive heart failure and the like that were eventually going to require those individuals to seek attention in the hospital. But unfortunately, after a period of time where we could have given them the best care possible. So these are just some of the examples that, I want my patients to know and feel confident that they can come and see me in the office and we can continue to take care of them to prevent problems. And especially when they're having problems at home, if they're having chest pain, acute shortness of breath, rapid palpitations where they may go into an arrhythmia, for example. While the emergency rooms are incredibly busy and the news would certainly paint the picture that we're overwhelmed, I want them to feel very confident that we are fully capable of taking care of them, and we want to see them in our emergency rooms when appropriate and necessary, and we definitely want to continue to see them in our offices where we can do things to keep them out of the hospital, which will unburden our emergency rooms and hospitals further.
Mm-hmm. The American Heart Association has identified 7 key factors for ideal heart health, and it's called the Life Simple 7. Can you tell us a little bit about that?
Sure. So the American Heart Association, I think one of the things that they do that's great is they're fantastic educators of the community and our states in the United States and all folks that might tune in to listen to their messages. And so Life Simple 7 is very much part of the kind of keep it simple methodology of teaching. So if we think about Life Simple 7, we're speaking about we want to make sure that we're managing blood pressure, controlling cholesterol, reducing blood sugar, controlling diabetes, and preventing diabetes where possible. We want to encourage folks to get active, to move more, to be habitually active in their lives, because no doubt our lives today kind of lead us to a more sedentary existence, and this is really not good for us. Mm-hmm. We encourage people also, one of the simple 7s is to eat better. For many of us here in the United States, and especially in the state of Indiana, losing weight is very important for us and can have significant health benefits. And then the 7th thing would be for those that are smoking to stop smoking. So in brief, just real quick, it's manage blood pressure, control your cholesterol, reduce your blood sugar, get more active, eat better, lose weight, and quit smoking. And when we can do these things, studies have been done worldwide that have looked at achieving the target goals for all of these 7 things. We can reduce the risk of cardiovascular disease, including heart attack, heart failure, stroke, by 90%.
Wow.
And so it's a really extraordinary bang for your buck, if you will, if we can kind of get to these things. Many years ago, there were messages about from the American Diabetes Association as well about know your numbers. And so I think as I talk to my patients, many of them probably weigh themselves from time to time and they know what their weights are. But I also tell them I think that they ought to know what their blood pressure is. And so for many of us who either have high blood pressure or are at risk of high blood pressure, I ask them to measure their blood pressures at home because, you know, as the old saying goes, if you can't measure it, you can't improve it. Mm-hmm. And so I think we need to measure our blood pressure to make sure that we're addressing it head on, getting it under control, because it's a silent killer that just tends to be completely asymptomatic throughout our lives until it's symptomatic. And the symptoms of high blood pressure are stroke, heart failure, and kidney failure. And I can't put it any more simply than that. Stroke, heart failure, and kidney failure are the symptoms of high blood pressure. And virtually nothing else becomes symptomatic to folks with normal run-of-the-mill high blood pressure until they get one of those 3 target organ defects, which is a real problem. And so we need to make sure we're measuring our blood pressure, get it under excellent control. And that can have a big impact on our life for us.
Mm-hmm. And if I'm not sure, as a younger person who's about to enter their 30s, if I'm not sure where I should be or where I'm at, how do I start that conversation with my doctor?
Right. So I think that, if we go back to we're going back 20, 25 years, the American Diabetes Association had a know your numbers thing, and they wanted people to know what their blood pressure was. They wanted people to know what their cholesterol was. And they wanted people to know what their blood sugar, or A1C, which is a measure of your average blood sugar over the last 3 months, is. And so as an individual who is looking to take a little bit of control of their own health, I would say know your numbers, know what roughly your ideal body weight would be. Mm-hmm. In the United States, we typically refer to ideal body weight along BMI, and so normal would be between 20 and 25. And if we look in the state of Indiana, 2/3 of us have a BMI above 25. And so it's overweight or frankly obese if your BMI is over 30. And so I think knowing your numbers and talking to your physician about, what's a good ideal body weight for me? What should my blood pressure be? And I would tell you for most of us, a blood pressure under 120 systolic and under 85 diastolic is considered sort of optimal. Mm-hmm. And frankly, for young people in particular, I would say a diastolic of 80 to 85 is into a pre-hypertensive range even. So diastolics of less than 80 would be even better. So 120 over 80 for blood pressure. Your LDL, the quote-unquote bad cholesterol, optimally should be less than 100. Our blood sugar, our glucose, should optimally be less than 100 fasting. And then again, I speak of the BMI, and one can kind of look up BMI calculators on the internet and put in your height and weight, and it'll kick out what your BMI is, and it should be less than 25 and greater than 20.
Mm-hmm. And because we are at the start of the new year, we're still kind of in January, getting ready to go into February. If my goal was to start eating healthy and losing weight, which falls into the Simple 7, and I fall off, is it still good for me to try to hop back on, or should I wait? What should I do?
Absolutely. Hop right back on. This is, one of the things I talk to my patients about as well is that life is not about sprints. It's a marathon. Mm-hmm. And we have many, many opportunities, to try to do the best for ourselves. In fact, I feel like even when we quote unquote fall off, we're still doing the best we can oftentimes in those times, right? Mm-hmm. I mean, this is just decisions we make from time to time. But I think having a healthful lifestyle most of the time is really our goal. I talk to my patients about the following. I say to them, it's probably not imperative that we eat perfectly healthy 21 times a week, but it's probably absolutely mandatory that we don't eat or make the wrong decisions 21 times a week. Mm-hmm. And so when we have splurges, when we eat foods that are higher in saturated or, possibly even having trans fats, or we, have holiday eating or travel times and things like this, food is so much more than just the nutrition it provides to our bodies in the United States. It's a part of celebrations and social gatherings and so on and so forth. And so it's going to be very, very difficult to eliminate all of that. But again, I think that recognizing we don't have to make the right decision 21 times a week, but don't make the wrong decision 21 times a week, mm-hmm. and get right back on that horse and just make sure that the next meal, if you can, is as healthful as it can be for you. Make sure that if you didn't work out, or we say workout, I jest with some of my patients as well that, 100, 120 years ago in the late 1800s, people didn't use the word exercise. If we went back to 1890 and told people that we walk nowhere on a treadmill for 30 minutes in the morning, they would look at us like we had four heads. and yet today, of course, just our lifestyles, the way the world has evolved for us in the United States, for many of us, not all of us, but for many of us in the United States, these are our ways of being active, and our bodies still require that activity. We haven't evolved to be sedentary at all. And so, taking time for ourselves to exercise, and when we don't achieve our goal on a given day or even a given week, get right back up on that horse and get after it again the next week. And I think that that's our goal for our life.
Mm-hmm. And Dr. Gill, as we start to wrap up, is there anything left that you want to hit on again, or anything that we missed mentioning?
I don't really think so. I would just... one thing that I've been talking to some of my patients about here lately, of course, here in the month of January, as many people are sort of coming onto their New Year's resolutions and contemplating what this year will look like for them, it always saddens me a little bit that people beat themselves up about their weight, and that they beat themselves up about their food choices quite as much as we do. And I just wish that I try to reemphasize with them just healthy and healthful lifestyle choices that we can make. And then I think that doing the best we can to try to make those healthful lifestyle choices, to choose foods that are lower in saturated fat, lower in sodium in particular, because sodium tends to be at the crux of high blood pressure for a lot of us. Mm-hmm. I think that incorporating fresh fruits and vegetables on an absolutely daily basis for all of us is really important. And it's remarkable. I don't know if this is your experience at all, but the experience of a lot of my patients, and I think a lot of others, including perhaps myself, is that I have to be purposeful sometimes, mm-hmm. about incorporating fresh fruits and vegetables into my diet to make sure that they get there. And so I think that just keeping those things in mind, these are the kind of things we can do for ourselves. I think not skipping care, I just want to reemphasize that, I think is super important, especially in this time of pandemic where we're sort of isolating ourselves from friends and family and maybe from physical activity in some cases a little bit more. I think maybe taking a little bit of extra time to spend and focus on our own care and health is going to be really important going forward.
One of the topics we did not get to talk about during this conversation is how COVID exposed health inequities. A future episode of Indy's Connection will revolve around this conversation and talk about what that looks like here in Central Indiana. Until then, you can visit the American Heart Association's newsroom to read more at newsroom.heart.org. It will also be linked on the web post for this story. Find it at RadioNOWindy.com and search Indy's Connection. Thank you for joining me this week, and please join me again next week. In the next show, I'll be speaking with an expert about Indiana's legislative process and how it works. Until next time, have a great week.
Radio Now 100.9's Indy Connection with Emily Metheny.